Langworthy.
Well, thank you very much. Mr. Speaker, as a proud member of the Rural Health Caucus, I join my colleagues in celebrating Rural Health Month, and I want to highlight the great work of rural health care providers across my district. I represent rural communities across western New York and the southern tier, the counties along the Pennsylvania line. Many of my constituents will tell you that their access to high-quality, affordable health care is a lifeline, whether it's preventative care, managing chronic conditions, or emergency treatment. In rural areas, health care providers are often the first and sometimes the only line of defense against serious illness. One example in my own district is an innovation by Roswell Park Comprehensive Cancer Institute with their mobile lung cancer screening facility that they call EDDie, which I had the opportunity to tour earlier this month. This program and vehicle takes healthcare directly into our rural communities, offering screenings that catch lung cancer earlier and improve survival rates. It's not the large medical centers doing this alone, but community health centers across my district that are stepping up to fill a gap, like the Southern Tier Healthcare System based in Olean, or Schuyler Hospital in Montour Falls, or the Chautauqua Center with locations across the Southern Tier. There are too many excellent rural healthcare providers to name them all. These centers are the cornerstone of rural healthcare, providing essential services like primary care, mental health support, and preventative education to populations that might otherwise go without care. I also want to speak to the importance of our community pharmacists. They play a critical role in rural health care. These local pharmacists are often the most accessible healthcare professional for rural residents that they have the most access to, offering guidance from everything from medication to chronic disease management and advice on appointments. However, our rural communities and their healthcare providers, they face significant challenges. For many families, the nearest hospital or specialist could be hours away. It makes it difficult and sometimes impossible to get timely care. And at the same time, rural areas struggle to recruit and retain skilled doctors and nurses and other professionals, leading to shortages and burnout. On top of that, many rural hospitals and clinics operate on razor-thin margins, and too many have been forced to close their doors. When these facilities shut down, entire regions, counties, communities lose access to essential services, forcing residents to travel even farther for care. And that's why I will always fight for common sense policies that strengthen rural health care, ensuring that no one is left behind because of where they live. I'm proud to lead the Rural Telehealth and Education Enhancement Act, which reauthorizes critical funding for programs that expand telemedicine and distance learning in rural areas. This bill, which is included in the House Republicans' Farm Bill, would invest in new ways for patients to connect with medical experts, improve access to specialized care, and enhance health outcomes in our communities. And with that, I want to thank every single healthcare provider who has dedicated their time and their talents to serving Americans in rural communities. The work you do saves lives and makes our country stronger. Thank you, and I yield back.